Want to hear why the hardest thing to do in American politics might finally happen this year, even though it's never happened before? Check it out.
If we're able to stop Obama on this, it will be his Waterloo. It will break him.
It will break him. It's Republican Senator Jim DeMint of South Carolina, presumably trying to rally conservative activists to oppose health care reform on a Friday conference call. What he actually did, of course, was give the White House all the ammunition they need to portray the opposition to fixing health care as a political goal that has everything to do with scoring points against Democrats and nothing to do with what's right for the country.
Just the other day, one Republican senator said, and I'm quoting him now, "If we're able to stop Obama on this, it will be his Waterloo. It will break him." Think about that. This isn't about me. This isn't about politics. This is about a healthcare system that is breaking America's families, breaking America's businesses, and breaking America's economy. We can't afford the politics of delay and defeat when it comes to healthcare. Not this time, not now.
On the Republican side, there isn't yet a counterproposal on the table. So the fight is not about what to do about health care. Right now, it's about whether or not we should do anything at all. The Republican Party chairman today gave a press conference in which he said that plans to reform health care were socialist, and then he said he wasn't prepared to actually talk about health care policy at all. His exact phrase was, "I don't do policy."
Do we support requiring individuals to get health coverage? Again, that is one of those areas where there's different opinions by some in the House and the Senate on this. And look, I don't do policy. I'm not a legislator.
I don't do policy. I'm just here to do a press conference about health care policy. Why are you asking me about policy? What is this policy anyway? Mr. Steele also managed to miss the news that Harry and Louise, the TV ad couple who helped kill health care reform 15 years ago, are now actually for health care reform.
Harry and Louise helped save us from Hillary Clinton's health care experiments in 1994. This year, Harry and Louise have been replaced by another couple, Harry Reid and Nancy Pelosi.
Actually, it's not the 90s anymore, and even Harry and Louise know it.
Well, it looks like we may finally get health care reform.
It's about time, because every day, more and more people are finding they can't afford health care. A little more cooperation, a little less politics, and we can get the job done this time.
Joining us now is Pennsylvania Governor Ed Rendell. Governor Rendell, thanks so much for joining us tonight. Really appreciate your time.
Well, hi, Rachel. How are you?
Great, thanks. I got to ask you, you've got a great political compass. You can predict things well. Is this finally the year? After decades, are the stars finally going to align to fix health care?
Absolutely. I think the people in the Senate and the House, Democrats and a lot of Republicans too, understand that Barack Obama was elected to make change, and the primary domestic change that the American people want is accessible, affordable health care that can't be taken away from you when you get sick, health care that can't be denied to you because you have a pre-existing condition. The system needs change. It's broken. The American people want to fix it, and Congress will eventually respond.
There is not a Republican counterproposal on health care policy. RNC Chairman Michael Steele admitted as much today. Essentially, he said that he was there to do a policy-free, pure politics discussion of health care. And given that that's so far been the Republican approach, I understand why they're calling for a delay. The thing I don't understand is why conservative Democrats, some conservative Democrats, are also calling for a delay. Do you understand that?
Yeah, I do in part because I think there are a lot of conservative Democrats who are afraid of exploding deficits. And the prediction from the CBO is something that makes everyone step back and say, wow, how are we going to pay for this? I think the proposal to tax the top 1% of people in America and pay for health care that way and pay for health care by the cost containment that the president wants to put in place are very reasonable and something we all should support. But I'll tell you what one of the problems is. It's the way the CBO scores things. There's no doubt in my mind from our own experience in Pennsylvania that you can do cost containment and cut costs. And let me give you just one example. In Pennsylvania, we passed an aggressive law to police hospital-acquired infections. Hospital-acquired infections were killing 2,500 people a year in Pennsylvania, costing in charges to the system $3.5 billion. In just 1 year after the law, we reduced hospital-acquired infections by 8% and cut $358 million of charges out of the healthcare delivery system. And that's just one of 20 different ideas to contain and cut costs. So we can cut costs. I don't know how the CBO scored it and said there are not going to be any cost reductions from the Obama plan. I think the Obama plan will cut costs dramatically. We're going to find out that it's far more affordable to do this than anybody thinks.
The argument from the Republican side has been not that there is some way to reform health care that's different than what the president and Democrats are proposing. Their argument thus far, and it may change, has this boiled down to we have the best health care system in the country. Stop whining. Why do you want to mess with something that's working so well? Do you think that that's going to be the plan they stick with? It seems to me that has to change.
Yeah, and I don't think that washes with any of the American people. And the statistics are pretty clear. We have the most expensive healthcare system in the world, but in things like infant mortality, cancer rates, things like that, things that govern wellness of a people, we're in the mid to low teens. We're 15th or 18th or 19th. So we're spending the most, and we're not getting the best return on our investment. Far from it. So this system has to change. Look, do we have the best doctors and hospitals in the world? Of course we do. Of course we do. And we should be proud of that. But the system needs changing. The system can contain costs. Very common sense ways of doing it. And there's no excuse for the richest country in the world to have 47 million Americans without health care and another 30 or 40 who have inadequate health care that drops them if they get cancer, for example. That's unacceptable in the U.S. of A. in the year 2009.
Pennsylvania Governor Ed Rendell, thanks very much for your time tonight, sir. It's always great to have you on the show.
Thanks, Rachel.